Are you considering having surgery for your chronic pain, but unsure about the myths surrounding it? Share your chronic pain experience in the comments section. Now, in this video, we're going to be debunking the most common myths about chronic pain and surgery, from the effectiveness of spinal fusions to nerve ablations. We're going to separate fact from fiction, whether you're living with fibromyalgia, arthritis, or some other kind of chronic pain. This video, we're going to provide you with more education to help you make a more informed decision about chronic pain. Now, when we look at the statistics of chronic pain, there's about 24% of the United States have chronic pain. And actually, I feel like that number is probably a little bit higher. In our office, we typically see the clients that have tried everything, nothing's really worked, and they've had pain for years, not really figuring out what's going on, why it's happening, and we're able to help them navigate their journey. So why does chronic pain happen? Well, I can give you so many different reasons, and one of the big reasons is our medical system. It just is not good at sitting down, having a conversation to get the whole picture, to figure out where the source of the problem is coming from. So for example, you go to a doctor, they spend 10 minutes with you. They want to image the spot. So if you have back pain, they're only looking at the back, and they're going to just do an image on the back and go, okay, this is what's going on based on the image. Here's some pills. Let's go and do surgery. Like, that's common. Or they'll say, okay, we're going to be a little bit more conservative. We're still going to give you some pills and injections, but let's do physical therapy. When you look at physical therapists, not all of them, but a big bulk of them, especially when you go to places where they're seeing a lot of clients at the same time, they're very cookie cutter. So that's like, if you have, we'll go with hip pain, they're only going to look at the hip. They're going to be like, okay, yeah, you're weak here. Let's only do some exercises. Well, we didn't really look and see, like, where's the source of this is coming from. So going to the side of the pain doesn't help you, because the pain could be coming from, if in the hip, could be coming from the back, could be coming from the thoracic spine, could be coming from the hip. It could be a combination of several things that happened over time that has just kind of creeped up and gotten worse and worse and worse. And so those clients are in this chronic pain phase, and not able to figure out what's going on, because you're not getting to someone that can really put all the pieces of the puzzle together. Another thing is that we look at when we go to medical providers. Each medical provider has their own little specialty. So you go to massage and they only look at the tissue. But what if the tissue is a symptom of something else that's going on? You go to physical therapy, they only look at strengthening. But what if something's not really moving that needs that piece done first? You go to a chiropractor, they only look at the joints. But what if the joints are moving, but there's a compensation pattern that needs to happen with it? So you really got to get to the source of what's going on, and it's not just one thing. And that's a big problem with our medical system. Now, you also, when we talk about the source, I talk about 5 different sources that can kind of create pain. One is mechanical, another one is chemical, another one is thermal. Then you have like autoimmune, and then emotional. So those are like kind of the 5 broad categories. If I have someone that's in and it has a huge emotional component that's creating some of the mechanical issues, if we don't take care of that emotional component, it doesn't matter what we do on the mechanics, they're not going to get better. We've got to get to the source of what is happening. They've got to take care of that first, then we can take care of the mechanics of what's going on. Just like, so let's go through all 5 categories. So the first one, let's go into thermal pain. Thermal pain would be like burns and sunburns. Those are completely different. Let's take those off the plates. Typically, you're going to see something like that, but definitely produces pain. Mechanical pain versus chemical pain. Now, a lot of times we treat mechanical pain with chemicals. And what do I mean by that? Drugs, injections, those kind of things. But if it's really, truly a chemical pain, that's something that just happened. You have an injury. There is all this inflammation. It's chronic pain, no matter what position that you put yourself in. You can't get out of pain. That's when chemicals can help. But it doesn't solve the problem, because you got to get to why did that happen. So a big case, why I can kind of, an example that I can give you would be, let's say someone had a kidney infection that produced the back pain. The kidney infection, you've got to treat with antibiotics, but you're treating the pain with something that's chemical, because it's constant aching. You can't change your position. You always feel it. You have to take something just to get through the day. So you're taking the drugs to help you get through the day, but you're solving the problem by taking the antibiotics. So same thing can happen with the mechanics. You can take the chemicals to start giving you some ease so that we can change the mechanics of why this happened to begin with. And so that's where you have to understand chemical pain versus mechanical pain. Chemical pain is always constant. You can't change your position to make it better and worse. It's just always there. That's chemical pain. Mechanical pain can be, you can change your position, you can make it better and worse. You can have mechanical pain that is constant, but you also can have mechanical pain that is intermittent. But if you have something that comes and goes with position, and you have something that isn't always there, it will, you do this and it makes it feel better or worse, and you do this and it makes it feel better or worse. Those are mechanics. You can't treat chemicals, injections with a case like that. It's not going to work, which is why you get it and it's like, it just didn't really do anything for me because you didn't treat the right category. So that's kind of the mechanics, is how the body moves. Are the joints moving? Are there patterns that you're doing that are creating some of the tightness in your joints? Are there weaknesses that are creating some of the tightness in the joint? Like, these are things that we have to look at to figure out the mechanics of it. But when you get to someone that's mechanical that understands this, you're going to get much better, much quicker results, and not just throw cookie cutter exercises at it. Now, when we get to someone that has more autoimmune type stuff that also creates pain, we see people that will have pain, they will have numbness, but there's no pattern to it. They can't make their pain come and go. And then you start asking them more questions like, are you bloated? How is your sleep at night? Are there certain foods that you eat that make you sick? You start going down this path, how are your energy levels? And they'll just start going like, how did you know all this? And I'm like, because we've already assessed all the mechanics. I can't reproduce that pain. There's nothing here that's making me think that it's mechanical. You present very much like someone that potentially has an autoimmune condition. I can't go and treat mechanics with someone that has an autoimmune condition. You've got to go to someone that specializes in the gut health and fixing and getting that back to balance so that all those symptoms go away. It can't just be, let's go send them to drugs. A lot of times when you go and see doctors, they're not really sure, and you go and do test after test after test. They may even send you to a psychologist. We've seen this before many a times because the doctors don't believe that there's anything wrong with them, even though they feel like crap and they have all these symptoms, because they're healthy enough that they can't find things in the blood work. So after you spend all this money on testing and different things, they might finally come up with a diagnosis of what they think it is, but then they're like, we don't have really anything to do for you, so they'll put you on prednisone. They'll put you on prednisone to lower your immune system so you don't notice the symptoms. They're not fixing the problem. You have got to get to your gut health and what is triggering some of the things in your body. We have places that we send people to help them with that. So if you if this sounds like you, then definitely go into the comment section and we can kind of help you navigate that a little bit better. And then you have that last category, which is the emotional category. The autoimmune and the emotional category really is only about 2% of our business. They are really tough cases, and our job, and we tell this to everyone, our job is to help navigate the healthcare system better for you. So even if we can't help you, we can get you a place that can. So when you have things like autoimmune and you have things that are emotionally connected to what's going on, you have to get that solved first. Now, when we have someone that is very mechanical, they're very emotionally attached to it. Everyone is, because they've tried so many different things. They just don't know if anything's going to really help them or work. They're going to be emotional about it. That doesn't necessarily mean that they have an emotional component. When we start giving them exercises or soft tissue mobilizations that they can do, or joint mobilizations, or whatever it is that we find that's going to help give them some relief, we found it that, wow, we do this, the mechanics are changing, they're feeling better, they're in control. A lot of times that emotional component will go away because they're in charge of how they feel, which is awesome. But there are times when it doesn't matter what we do, they're so fearful, they have a lot of anxiety, and they are just like, I just don't know, and they can't deal with a lot of things that have happened in life, or maybe there was something that happened in a certain period of time a long time ago that every time they feel what they felt back then, it recreates all those symptoms, and then they have them, and it doesn't matter what we do. It's not a mechanical thing, it's an emotional thing. And how I describe that is, a lot of times something can trigger it, whether it's overwhelm or something. that can trigger something that happened in the past. It's kind of like you are listening to a song and you hear a song that was in a movie and it takes you right to that spot in the movie in your brain. You can see it, that movie that's in your head when you hear that song. It's kind of the same thing. They hear something, they feel something, they see something, whatever the case may be, it's taken them right to that place, and they have to solve that part of it, do some cognitive behavior type therapy to help them deal with that in order for their body not to feel their symptoms. So there's a lot of different reasons why people have chronic pain, and if you go down the surgery route and you haven't really figured out what category you're in, it's not going to work. It's just not going to work. And I've given you statistics on like back pain. We do 200% more back surgeries, including fusions, more than any other country, 200% more than any other country. And it's because it's that 5-minute conversation, nothing's worked, we've tried injections, but no one's ever like looked at the mechanics to figure out where the source of the problem's coming from, and they go down this path and it doesn't work. If you do a back surgery and it's coming from another source, it's not going to work, which is why, like, if you take 10 people that have back surgery, maybe only 2 of them get really good results. Or three or four of them get really good results, but their symptoms come right back again because you're doing the same patterns and things that you did at the very beginning, and now your symptoms come back again, which is why they'll do a laminectomy or discectomy, and they're like, yeah, well, that was our conservative surgery, now let's go and do a fusion. Very common. When you do things like nerve ablations and things like that, the nerves regrow back. There's no guarantee that's going to help. Like, it can help for a period of time, but you're going to have to keep on doing it again and again. And you could have nerves that come back that make you more painful than you were before. So it's really important that you really find someone that is going to be able to help navigate what's going on with you and figure out the pieces of the puzzle to really help you get back to everything that you want to do. Now, if you're looking for a place like that, definitely reach out to us, because that's what we see. We see the crazy cases and kind of help people navigate where they need to go and do a really good job of it. And so if you're someone that's like that, definitely go into the description. We have other resources for you in the description, but we have things like a free discovery visit. If you want to come into our office to learn a little bit more, we have that for you as well. And again, make sure you like this, subscribe to our channel. We put out content all the time. Share this video to someone that really needs to hear this message, because it's not so simple. Chronic pain's not so simple, but it doesn't have to be chronic. There are things that you can do, but you have to get to someone that understands the body. And we always say where the side of the pain is often not where the source of the problem is coming from. So you have to get to someone that really understands how all the pieces of the puzzle fit together.